Hi, I'm Jana and this is my best friend Edel.
Hello.
We're in front of the succulent,
Who is just like
hanging by the thread. She looks like a thread.
so sad. We didn't kill her. I mean, we tried to give so much love. Maybe our love was toxic. Sorry.
Okay, so most of you don't know that Edel is a doctor and she's a family medicine specialist and an infectious disease specialist as well.
Yes.
And right now, Dr. Edel is working in the COVID ward in a hospital. And since we're in the time where we're looking at news every day and we hear so many things about the virus, I just thought we could do a short getting to know about the virus and what precautionary measures we could take to, as much as we can to take care of ourselves. So we will, I'm just going to ask you a couple of questions, and if you could help us understand, that'd be great. So, what has been your experience working in the COVID ward? What is it like?
Hectic, but so rewarding. And also, so much of faith is involved, something that I had not been used to in the medical field. You've studied it, and then something happens, and then you deal with it, and this has been it's always a collaborative effort. We get many specialists, and we've always treated patients like that, but now you're so alone. You're just so alone. And medicine, as we knew it before, can no longer hold anymore. My instinct, if somebody is crashing, is to run towards the patient. But now with the visor and the PPE and the patients all having to wear a mask as well, I can't perform a CPR. So, and we can't get, if we can't even put out a crash call, because we work in a COVID-19 ward, right? The other specialists aren't allowed to come inside. We can't get other, we have our own lift, we have, everything is just so separate,
Very
right?
isolated.
Yes. And that one is like, it's a whole new body language I have to learn. Just breathing and being able to, like sweating inside my mask and getting tired very easily and being very exhausted and hearing my breath and walking inside a PPE. That's a challenge in itself. And the third one is, this is not going anywhere. This disease is just going to get bigger, and it's going to take the repercussions, the ripple effects of this one virus is in socioeconomic statuses, that things are going to completely shift. I'm not even sure. I mean, this could be the kickstart of cryptocurrency even, something as far off as that. We've gotten together as a world and very, very isolated all together, all at the same time. So it's brought about huge socioeconomic upheavals, huge personal and interpersonal relationship upheavals, huge mental, psychological upheavals. The world as we know or knew up until February in Chennai doesn't exist anymore. And to think we can bring it back, our downfall is to try and live like we lived pre-February.
Because I hear a lot of people, they say, I just want this to be over. And I don't want to burst their bubble saying that it's not going to happen. Life is not going to be the same. How do we deal with something like that?
Accept it. Don't fight it. Nobody is trying to be, I'm not trying to be fatalistic. I'm just saying that there was a time when there were naked sadhus walking on the streets of our country, and we didn't think that was obscene or offensive. Now you barely see anybody without a shirt on, like ever, right? Likewise, there's going to come a time where you will not prefer to be with a person who voluntarily takes their mask off in public. You'd think that is just not the right thing to do. This is a bad person, has no manners. our sense of social distance is going to become big. Like sitting close to somebody is going to be an incredible luxury. Things like online dating apps and where people would hook up apps basically, that's going to change extremely dramatically. How people viewed gatherings is going to change. How we all would crowd and sit, that's going to change. We're going to live a lot simpler. We're going to have to live a lot simpler. Some people don't have the choice. We have to live simpler. Some people will make the choice. I wouldn't be surprised if we have a lot of... I think people are going to work more from home. So therefore public transports are going to get lighter. Pollution is going to be lesser compared to before. We're going to have to maybe people will prefer to homeschool their children because it's frightening. Yes, right? Voluntarily, not because they've been forced to. Yes, it's going to be far, far-reaching, and these few months of lockdown, right? A few days ago, I heard an economist on YouTube. He was talking about the ripple of this will be felt up until 11 years from now. And I don't know why he came up with that number. I didn't understand it too well. That wasn't my field of expertise. But he seemed very knowledgeable, and I thought it seems reasonable enough. Because we're not anywhere close to getting a vaccine, right? So the only way we can make sure we don't get the disease is by taking preventative measures by ourselves. And the second thing we can do is vaccinate ourselves. And the vaccine is not even close to. At least another 3 years. Definitely another 3 years before we can get a workable vaccine. Till then, we've only got like 3-4 months worth of knowledge about the virus. And we've gotten quite a good handle on it. Quite a good handle. As long as it's mild to moderate disease. For severe diseases, we're still not happy with the mortality rate because we'd like for the mortality rate to be 0. But we are learning patterns of the virus, and hopefully we'll learn a lot more within the coming few months, and we can have so much more medicines ready.
I think the pharmaceutical industry is doing very well right now, except every other
It
industry.
It always does. Yes.
So, what measures can we take? What precautionary measures can we take to...
Yes. Wear a mask. Always wear a mask. If in doubt, wear a mask. At this time, if you catch a cold or have a flu-like symptoms, or if you feel feverish, it's COVID until proven otherwise. So go to a center and get yourself tested. I understand that there is this fear of what could happen to you for 14 days after being tested because you're so scared. But here is the thing. What you're doing is a great sacrificial thing for humanity. Because when you get yourself tested, you're saying, I'm humble enough to make sure that if the test comes out positive, I'm not going to take a risk with the older people in my family or the more vulnerable people in my family. And if you get admitted or quarantined, you are a source of so much knowledge and data for the doctors who are striving to study about this germ, and we can win. It's just a matter of time. We are going to sort it out. Make no mistake about it. We are going to sort it out. It's just that we've never seen a pandemic before. So we are going to sort it out, right? But there's going to be lots of lives lost. That too is going to happen. Not because of lack of expertise, but it's because COVID virus is very tricky. And each person's response is incredibly tricky. So we've got a couple of patients who look so clinically completely good, but their bloods are all over the place. So you may feel just a tiny little bit of cough, little bit of sore throat, little bit of a fever. Get yourself tested, please. You're doing everybody. Because right now, we shouldn't think of just ourselves. We should think about everybody. Then the next one is social distancing. Every time we speak, the particles in our mouth, the saliva, can go up to a meter, right? And if you sneeze, sometimes it can go up to 3 meters. Wearing a mask lets the particles out of your mouth, if it's the poorest type of porous masks, and the maximum distance it'll travel is about 60 centimeters. And even though that's not the greatest thing, it's still something, right? So wear a mask at all times. Social distancing is so important. And it is very, very difficult, especially considering how populous our country is and how crowded and close, and our sense of personal space is small as well, isn't it? So for us, that is going to be our biggest challenge. Right now, India has the highest population of diabetics and hypertensives in the world. And that's because we have forgotten what our traditional eating habits were, right? And we come from a lineage of people who would do a lot of physical labor with very little food in a day. Like we would work physically for at least 6 to 10 hours a day and eat maybe 2 meals in a day. That's what our body knows. But now we are sitting for at least 8 hours a day and we are eating 3 square meals, and usually we Swiggy it or we Uber Eats it, you know. And this is not, and we still bear ancient DNA, ancient wisdom that courses through our veins. And we haven't mutated to like the latest OS. We haven't. We're still an ancient body. And the changes around us are so fast. And most of the food that we're eating, we do not recognize. Go back to cooking from scratch. It is very difficult, but this has to happen. This has to happen. Cooking from scratch, cooking simple vegetables, eating less, moving more. And I think because of COVID, lots of people cannot afford home help anymore. They probably start doing the household work by ourselves. That would prove to be good exercise. Lots and lots of people have started being more concerned about their health and wellness. So the taboo of going to a psychiatrist is no longer there because many psychiatrists come to us online. Please make use of it, please, right? Read a lot of good literature that's healthy for our minds. You can get in touch with your stillness meditation. There are lots of meditation apps. You can start doing yoga. You can spend time with your pets and your family, things that we couldn't or wouldn't do before. Start doing your hobbies. We'll find little pleasures that we lost taste for because we chose intense experiences instead of simple daily duplicatable pleasures.
So look for activities that will help serotonin instead
Yes!
of dopamine.
Sleep for 8 hours a day, especially in a very dark room. And if a dark room is not possible, wear a mask and sleep. I would recommend gargling your mouth with salt water at least twice a day. If salt water is not possible and it gags you, Listerine mouthwash as often as you possibly can. Get yourself a Vicks inhaler and inhale as often as possible. It's only got eucalyptus and camphor in it, and it creates a very hostile atmosphere for inside your sinuses and in your throat and all the crevices between the villi for the COVID virus. Steam inhalation is also very, very good. Please take steam inhalation. We've now the turmeric supplement that people used to prescribe for post chemotherapy cancer patients is now available as for anti-inflammation as an anti-inflammatory. It's got curcumin and pepper extract in it, black pepper extract, and taking it twice a day is wonderful. If having access to this medicine is not possible, I would recommend half a small teaspoon of pepper, ground black pepper, mixed with 1 heaped teaspoon of turmeric. Mix it in hot water, let it settle, put a straw because you don't want to stain your teeth, and drink it up early in the morning every day. Hydrate yourself. At least 3 to 3.5 liters of water every day is very important. Keep moving. Keep moving. The people that move a lot, the people that work out a lot, it's very difficult for them to get sick because they'll be using all parts of their lungs because they're breathing deeply. And if you're starting exercise for the first time and you can't suddenly start doing cardio, I would recommend the ancient Indian practice of pranayama, where you use deep breathing techniques to awaken all the parts of your lungs. If you see the COVID viruses CT screening, you'll see that most of the virus infection happens in the lower lung bases, and it's in the subpleural areas, which means it's just below the covering that coats the lungs. So I always use this analogy. The parts of our house that we don't clean the most are the ones that will collect dust bunnies and cobwebs, right? So take ownership of our lungs. Of course, if we're sitting still for 8 to 10 hours a day at work, we don't need to use our lungs, which is why we've lost the capacity of our lower lobes, and they become the most vulnerable to COVID. So if you move and learn to breathe deeply and expand your lungs, you will totally increase the chances of you staying healthy. And you need to be healthy, not just for you, but for your family and all your loved ones.
All right. So thank you so much for giving
You're
us
welcome.
that information, and hopefully we'll be able to adopt it into our life somehow. I mean, we have to, right? We don't have a choice now anymore.
Yes.
So if you guys have any questions, please feel free to write to us, especially because we're talking about COVID. Chances are you may have more questions. So feel free to write to us, and if you like the video, please share this with as many people as you can, because the more number of people that have access to this kind of information, the more we can take ownership of our own lives and our health. So we will see you next week, and bye-bye.
Bye.